Hey there, welcome to this week's episode of Next Level Play Therapy. So, some of you are watching and participating during the live stream, so welcome. Some of you may be watching on the live stream replay, and some of you may be listening to the podcast episode. So, welcome. For those of you who are participating in the live stream today, I would love to know who's here. Post your name in the comments. Where are you from? What population you work with? And let's dive into today's episode. So I have been fascinated with this idea of play therapy themes. And what even fascinated me more was overhearing a judge in a court case. I remember hearing the judge, as the play therapist, described some themes and play behaviors and her assessment of what was going on in the play therapy session. The judge asked a really valid question. And in my mind, if we can't answer this question, then that creates some problems really helping people understand what you're doing and what, most importantly, what's going on with the client and their therapy session, and is it real? So in play therapy, if you've been in the play therapy world for any period of time, or if you've been listening to any of my weekly live streams or podcasts, you probably have heard me talk about play themes. And what the heck are play themes? If you're interested, I have talked about those in previous episodes, so you probably want to go back and look and listen to some of those, either the podcast or listen to and watch some of the live stream replays. The easiest place to find those would be YouTube. The live streams recordings are all on YouTube, or if you're listening to the podcast, you can go back wherever you listen to podcasts and find those episodes. And so what are play themes? And the question that was asked of the play therapist was, well, I've seen kids play those out. So the kids that I've observed, they seem to be doing fine. Why is it what you're saying is related to the issue that you're stating it's related to? Like, how are you making those connections, essentially? Which is a really, really good question. And I started to take a deeper dive in this topic when I was creating my progress notes course. So it's called Getting Grounded in Play Therapy Progress Notes. And so I thought, you know what? I'm going to be talking about play therapy themes in the course. So I might as well take a deeper dive. And one of the things that I really like to do when I'm creating courses or creating trainings is I like to go and look at and see what the theory says. What the theory says, but I also like to look and see what the research says. So I go down these rabbit holes of research, and then one thing leads to another, and I come out with like 10 different articles, and then I kind of go through those. And while I was going through that research, I came across this article, and it was talking about recognizing play themes and really tying the ability to recognize themes with change, the healing process, change in the problem that clients are experiencing. And so I thought, well, I'm gonna do a live stream episode on that. I'm gonna do a podcast episode on that. And so that's really where this came from. I think, just kind of a side bonus for today, I think if I think there's an art and a structure to writing play therapy progress notes, really that align with your play therapy model. And so it makes sense and it doesn't take forever and you don't put too much information or too little information. And to me, part of that is recognizing themes. So if you're interested in learning more about some of the documentation courses I have available, I'll talk a little bit more about those at the end. So stay tuned for that. And let me check in and check out the comments for today. Steph is here. Hey, Steph. Good morning. Steph is in my Play Therapy Academy. A lot of these courses are in the Play Therapy Academy. And if you're not in Play Therapy Academy, these courses are available outside of Play Therapy Academy. Play Therapy Academy is my consultation program. So if you're interested in that, you can check out my website as well. And I'll talk a little bit more about that at the end. So let me talk a little bit about the topic today, what the research says. So like I said, when I'm creating courses, when I'm doing any kind of trainings, also this comes up when I'm doing consultation, I really like to look and see what the research says. So to me, it's important. I kind of look at 3 pillars to the work that I do, which is what theoretical model are you using? And now the current play therapy field, so to speak, we now have what I call second generation play therapy models, meaning we have this, what the Association for Play Therapy calls seminal and historical play therapy models. These are the kind of the ones that are the foundation of play therapy here in the US through the Association for Play Therapy. And now, as we've gotten more research and information from about neuroscience and attachment, now we're beginning to see kind of the evolution of theoretical models. I love neuroscience and attachment theory. Anybody who has worked with me knows we will talk a lot about that. And I get kind of nerdy and excited when I talk about it. I think it's so cool. I personally think on a general level, neuroscience and attachment theory information, you can pretty much apply that to most of those seminal and historical theoretical models. And what we're finding now is, as play therapists are gaining more knowledge and from the research, they're beginning to develop what I would call second generation models, which is cool. And they're going to be based on a theoretical framework. So to me, it's important to make sure whatever theoretical model you're using, you make sure to stick to it, even when you're doing an integrated approach. And this does tie into themes. So I'm going to talk a little bit more about that. So I'll connect that together. And looking at the research, what does the research say? And all of that in the context of a really strong therapeutic relationship. I consider that therapeutic rapport to be the glue. You're not going to get very much change without your client's ability to feel safe and secure, experiencing the play therapy process as that free and protected space to move towards healing and wholeness. That's the therapeutic rapport. That's the relationship. Your theory model is going to influence how you do that. And then research is going to give you some information about keeping up to date on what we're finding about issues and the factors contributing to issues and what to look for and what works and what doesn't work and those kinds of things. So that kind of brings me back to play therapy themes, because I thought, well, what does the research say about play therapy themes? And does the it's a projective model. Play therapy is a projective model, right? We are looking at projective content, so to speak, if we go a little more psychodynamic there. Then what is showing up in the playroom? I'm going to use my theory model to figure out what those themes mean. So, one of the things that I've talked about in previous episodes is um, play therapy themes. So, let me go over that a little bit. Play therapy themes are really the psychosocial content, unconscious and conscious, showing up in the playroom. So it's those issues that children are working through, and they're using the play process to communicate to us. The theory of play therapy, one of the foundational pillars of play therapy, is children communicate through their play. And I like to use the analogy of adult therapy. So, with adult therapy, therapists are learned to listen deeply to what's said, how it's said, and behavior, body language, tone that's showing up in the session based on what's verbally being communicated. And so that, to me, that's the same as play therapy, only we look at the play. We look at what's going on through their play. So we look at behavior, we look at the words that are spoken, we look at how they're using the toys, we look at statements that they're making, we look at all their interactions with us to get a sense of what the themes are. And then we're going to use our theory model to make sense of those themes. And then we're looking at themes over time. So from session to session to session to session. And that's what I found interesting about this research article that I'm going to go over, because they looked at some of this, which to me was really important, because we look at themes from session to session to session to session. We look at the changes over time. We look at any shifts. We look at shifts during the session. We look at shifts through the process. We use themes to help us understand what's going on and where children are in the change process. And again, this is where your theory model comes in. And a little bonus here, a lot of this is useful when you're writing progress notes. You can use the information. So one of the things that we know is that play therapy has become the go-to treatment model for working with children, helping children overcome their mental health challenges. And so to me, to continue to be relevant and stay up to date on what's going on, this is where research can come in and be very helpful. And so let me tell you a little bit about this study that I looked at. So these researchers, play therapists, they used a case study model. So they looked at 2 case studies using qualitative and quantitative measures to explore changes that were made in the play therapy process for these 2 children. So, and to me, that was what was cool, because it wasn't just using all of the quantitative measures. They were looking at some of that qualitative, where they were kind of getting a deeper look into what's going on in the sessions using a case study approach. So the 2 case studies they looked at were, one was a 3-year-old male demonstrating physical aggression, violent tantrums, stubbornness, and distressing nightmares. And there had been a report of sexual abuse by a family member. The second case study that they looked at was a 6-year-old male who was also demonstrating aggression, more generalized aggression, aggression towards other children, acting out and not following the rules. And in this family system, because we always like to look at children within context of the family, this was a two-parent family, and the child had a younger disabled brother. So what they did, which I thought was fascinating, what they did in this study was they used a coding system that was developed by Helen Benedict. Now, Benedict, I think this was probably back. I came in like the early 2000s. This coding system, I looked high and low to find this coding system. What I found out was it was a coding system that she had presented years. This is a few decades ago now, a couple decades, at a annual conference for the Association for Play Therapy, and then she's written about it. Her play therapy model, which is object relations theoretical model, and different themes. And a lot of us have used these themes that she identified in our work with children, which is how I came across them. My play therapy consultant passed them along to me. And I think now they're among people who have been in the play therapy field for a while here in the US. We probably know about Helen Benedict. Some people may not know about Helen Benedict. Anyway, she came up with this coding system. And so in this study, they trained their therapists how to use the Benedict's coding system to recognize play themes. And I found this because I searched high and low for this. I was like a dog with a bone on a mission to find everything and anything I could about this awesome coding system. Part of the reason was I wanted to make sure in my progress notes course, I thought it would be helpful to talk about themes and help people know what to look for in the sessions in order to know what to write in your progress notes. So there's a whole module on that. And one of it is talking about themes, and I kind of provided some information about that. And in this research, they used Helen Benedict's coding system. And what the other thing that they did was look at behavior changes that were made, and they used the child behavior checklist. So that's the more formal assessment. And so the play therapists were trained to use the Benedict coding system, and they used those themes, and those themes were documented in the play therapy progress notes. And changes in the themes were identified and compared to changes that were reported by the parents using the child behavior checklist. And the data points where data was collected were at session 1 and session 6. So that's an overview of the study. And you can kind of see, it took more of what I call a deeper dive into the play therapy sessions and actual practical application of how do you recognize play themes, and then how do you make sure that there's any progress through that. So the findings of this study were, and the implications for play therapists. So both case studies noted changes in play themes from session 1 to session 6, and these were consistent with behavior changes reported on the child behavior checklist, so that maladaptive behavior. So changes in play themes were also consistent with behavior changes noted on the child behavior checklist. So obviously there are some limitations for the study when you're using this type of structure, this kind of design for the structure. So in the research, the authors did talk about the limitations of the study and using a case study approach For example, the difficulty making a definitive conclusion about the correlation between the play therapy approach as the sole factor for facilitating change. Um, but the purpose of the study was really to take a deeper dive, to take a deeper look in what was happening from session to session, and the role of play therapy and recognizing those themes to facilitate that change process. So this supports the ability for play therapists to identify when change is occurring, because that's an important part of using play therapy. This is the reason why it's really important to be trained in a theoretical model and not just pull out games and toys and art supplies and call it play therapy, because there's a lot more to it. So I wanted to read a quote from the research article because I thought it was really relevant. So this was in the discussion part of the study. And if you're interested in the study, I put the description or the citation. I put the citation in the description. So if you're interested in it and you have access to a research study library, then a professional, the literature, you can go and access that. And so the name of the study is a comparison of behaviors and play themes over a 6-week period, 2 case studies in play therapy. So I was reading that from my notes. Okay, and the study was done by Marilyn Snow, Edward Hudspeth, Blake Gore, and Heather Seal. And the study was published in 2007. So it's a little bit on the dated side, and I felt like it still had really good information that was still useful. So I thought I would share it. So let me read sorry, my dogs just walked in the room. You probably heard the door open, and sometimes you might see Luna, like if you're watching on the video, the replay, or even live stream, you might see Luna like walking behind me. Luna's the bigger dog. Lily's the smaller dog. And if you hear any crazy digging noises or moaning, it's Luna. She's just kind of hanging out and she's hearing me say her name. So anyways, okay, so here's the quote. The practicing play therapist routinely observes changes in play themes and receives reports from caregivers on changes in behavior outside the playroom. Using a quantitative method of assessing behavioral changes, such as the child behavior checklist, along with qualitative observation of play themes, would allow clinicians to clarify the actual changes brought about by play therapy. And that really just summarized to me why it's important to be able to recognize play themes. And looking at the research, they kind of validated, in my mind, the questions I get asked all the time, the questions I had when I was using play therapy, which is, how do I know these themes are real? How do I know I'm not just making them up in my head? And how do I know what they mean? How do I actually use that information to help my clients to make sure I'm doing a good job and not just making things up? And to me, this article, this research study was important to kind of take a look at. They used a coding system for themes. So there was structure to that, using and identifying what the themes in the play mean. And they used object relations theory to understand and make sense of the themes. And then they used a more quantitative method of checking out what I'm seeing in the playroom. Is that consistent with quantitatively using a specific measure? Are those two matching up, or are we just like way off track? And so they use that child behavior checklist to recognize, to see if what was being observed in the playroom and understood about the meaning of the play themes, was that consistent with measured and reported changes being made. So in that way, I thought it was really helpful research. I thought it was an awesome study, and gives us as play therapists some validity and confidence that when we're trained to understand themes and we're trained to make sense of them, then we can feel confident that the play therapy process is actually working. And one of the reasons that play therapy has become, several models are considered evidence-based, is because there has been a lot of research done to validate the validity of the play therapy. And so that is it for today. If you found this information useful, please feel free to share across your social media platforms and leave a comment. I would love to hear your feedback. Let me do a recap for today. So first, what are play themes? So play themes are basically play behaviors and things that the psychosocial aspect of the issues that children are working. I'm a little tongue-tied. I'm a little distracted by my dogs. Like, oh my gosh, Luna's barking already. Anyways, all right, let me start over. So what are play themes? Play themes are essentially the kind of psychosocial, conscious, unconscious issues that children are working through, and they use play in order to work through those issues. They use play to communicate what's going on. So when we're trained to recognize play therapy themes, then we're going to make sense of it predominantly through the lens of whatever play therapy model we're using. A lot of themes are similar, like there's a lot of themes that are generalized across pretty much most of the play therapy models, maybe not all of them, depending on the play therapy model. And how we're going to make sense of them is going to be based on our theory model. And so in this study, really the focus of the study was about, since play therapy is an expressive arts approach, using projective content to facilitate the change process, research can really help us understand better how play therapy works and make sure it's used effectively. So in this study, they used 2 case studies. They had play therapists who were trained to identify themes using the Benedict coding system that's based on object relations theory. And then they also use the child behavior checklist to measure behavioral changes. So it was both qualitative and quantitative. And they did talk about some of the limitations of this research design, and it still gives really good information. So the case studies, from the findings of the case studies, were, the research was that both qualitative and quantitative approaches, they used those to get a deeper look into what was going on in the sessions, recognizing play therapy themes, and then seeing how that, whether or not that was consistent with what information was obtained from parents with the child behavior checklist. And what they did find is those were consistent. They measured and obtained data. They obtained data at the first session and the sixth session, and they did notice that those changes in themes were consistent with what was being reported as behavioral changes in that child behavior checklist. So that is it for today. If you're interested in my courses, I have some online courses. One of them is Foundations in Play Therapy, really getting a solid understanding of what play therapy is. And I give some tips in there about questions that regularly get asked about how to talk to parents about play therapy, how do you set your playroom up, what toys should you use, some other kind of ethical kind of things to consider in play therapy that we come up with all the time. And then I have some what I would call foundational core competency courses in there about case conceptualization, which really is learning to be a play therapy detective, figuring out what questions do you need to ask to figure out exactly what's going on, and then how do you make sense of that based on your play therapy model. And the reason I developed this course is because what I was finding was people would come and I do consultation or I do trainings, and people would ask questions like, what should I do? What intervention should I use? And they hadn't really figured out what exactly is the problem. So I found myself walking them through that case conceptualization process first, so that then we could answer the question of what should I do. And a lot of times what I find is people get lost. They don't know what's going on. Then their imposter syndrome kicks in. They go looking for any kind of strategy that might work, and it becomes a lot like throwing spaghetti against the wall and hoping something sticks, rather than going back through that case conceptualization process to figure out, okay, what is going on? Where are we in the change process? That's right. Here are the roots of that. Let me walk that through. Okay, so here's what I need to do. The case conceptualization process is really most effective in helping you make sure you know what's going on with your client. You can always go back to it. You're kind of always updating it as you go through the process. But if you have the core case conceptualization first, you start with that instead of skipping that step and then getting lost, then it really does help you the rest of the way through. So I talk a lot about that in the course, walking you step by step. What questions should I ask? Why should I ask them? How do I take that information and then use a theory model to conceptualize what's going on? And I walk you through using case studies and different theory models. How do you do that? And then we go through some other kind of ethical and cultural things in there. And then that kind of leads to treatment planning. Like, now that I know what's going on, what do I do? And treatment planning is more than just your treatment plan, because if you don't do those other steps, you can really struggle with writing your treatment plan. And the reason I created this course, is because people were struggling with their treatment plan. And what I realized was they hadn't really gotten those first steps of what's going on. And now, from a treatment planning standpoint, what do I need to do? Which that will ultimately lead to the actual treatment plan, and creating a treatment plan that's actually useful and not feel like it's a waste of time. And then how the heck do you write them? Like, really the step-by-step process of how do I break down what's going on into actual treatment goals and objectives, so that align with the play therapy model, that actually makes sense and will meet meet requirements for most insurance companies and agencies, and kind of get you in, like walk you step by step through the modules. They're all pre-recorded, and have you do some activities so that you have an idea of how to write those treatment plans. And you really need those other steps. And then the last course I have in there is progress notes. So how do you write progress notes? What do you say in your progress notes? How much is too little? How much is not enough? Pretty much everybody I've ever talked to, which was one of the big reasons why I wrote the course, created the course. There are so many horror stories out there. There's a lot of what I consider to be bad advice out there. How do you write a progress note that actually looks like you've done something therapeutic and it's grounded in some kind of making sense? Other than I played with my client for 50 minutes and we played Uno for 50 minutes. Like, why did we play Uno? What did the client accomplish? How do you recognize what's going on there? How do you recognize where they are in the process? And then how do you document that? How do you take that information and put it in a progress note and learn how to do it so that it doesn't take forever and you're not agonizing over them? So that is it for today. If you are interested in any of these courses, you can pop over to my website at rhplaytherapytraining.com/courses. So you'll want to go on the courses page. Again, that's Renewing Hearts Play Therapy Training. The website is rhplaytherapytraining.com/courses. And that is it for today. And I will see you next week. Bye for now.